Hi, I'm Sam. I'll be your student nurse today. What is your name and date of birth?
Susan Poe, April 3rd, 2003.
Okay. Oh, check your wristband. Okay, it matches. I'm here to do a physical assessment on you. Your vital signs were taken earlier, and the range and the values were all within normal limits. Are you in any pain today?
No.
Any allergies?
No.
Okay. Can I touch you today?
Yes.
Great. When the patient walked in here, I noticed that her posture is erect, her gait is steady, her speech is clear, and her affect is calm and cooperative. All right, Ms. Poe, what are you here to do today?
To get a physical.
And where are you?
My house.
And what day is it?
September 20th.
Okay, the patient is alert and oriented ×4. First, I will be looking at the skin in your entire body. So your head, your chest, your arms, your legs. Your skin is warm and dry. The color is appropriate for ethnicity. There is no bruises, swelling, edemas, lesions, scars. The texture is smooth. There is no cyanosis or pallor. And looking at the face is symmetrical bilaterally. Looking at the eyes, can you pull your eyelids down? The conjunctiva is pink and moist. The sclera is white, and the corneas are clear. All right. Looking at your nose, can you go ahead and close one side and breathe on the other? Okay, and switch. Can you breathe? Is that all right?
Yes.
Okay. So the nose is patent. Looking at the ears. Any tenderness?
No.
There is no tenderness or redness, and I know that the hearing is intact because she responds to my spoken word. All right, looking at the mouth, can you go ahead and open up, please? All right, the oral mucous membranes are pink and moist. The uvula is midline, and the dentition is intact. We're going to go ahead and test her pupils now. So I'm going to go ahead and look forward. Ms. Fall, have I pen? All right, go ahead and look at the wall, and then look at my pen. Okay, the pupils are equally round, reactive to light, and accommodation. Okay, so that is the head. Next, I'll be moving on down to the neck. So I'm going to feel the palpate for the carotid arteries. The carotid arteries are palpable, +3 with a regular rhythm. And then I will be listening for a carotid bruit. Just go ahead and take a breath, or hold your breath. No bruit is noted. Next, I will be listening to the heart sounds. So the aortic sounds can be heard on the right side of the sternum on the second intercostal space. The pulmonic sounds will be heard in the second intercostal space on the left side of the sternum. The Erb's point will be heard in the third intercostal space on the left side of the sternum. The tricuspid sounds will be heard on the fourth intercostal space to the left of the sternum, and the mitral sounds will be heard on the fifth intercostal space on the midclavicular line. I'll listen there for a minute for the apical pulse. I know to listen to these sounds on bare skin, but for patient privacy, this will be done over her clothing. typical heart rate is 81 beats per minute, and it is regular. There were S1, S2 sounds noted, no murmurs or clicks. Next, I was listening to the lung sounds. I was listening to 6 sounds on the anterior side and 10 sounds on the posterior side. Just go ahead and take a deep breath every time you miss the scope. And turn around. All right, thank you, Ms. Poe. The lung sounds were heard symmetrical bilaterally. There were no abnormal sounds such as wheezes, crackles, or stridor. And her breathing is unlabored and easy. Okay, we're going to move on to the abdomen. So go ahead and lay down for me. All right. Can you go ahead and lean up at a 45-degree angle, please? All right, go ahead. Good. There's no JVD noted. Again, for patient privacy, we're doing this over clothing, but I would look at her actual abdomen during an exam. But looking at her abdomen, there's no distension and it is symmetrical bilaterally. I'm going to go ahead and also tape for gut sounds first. Gut sounds are heard in all 4, normal active gut sounds are heard in all 4 quadrants of the patient's stomach. I will now go and palpate the abdomen. Go ahead and tell me if there's any tenderness when I do this, okay? Any tenderness? There is no tenderness in any quadrant of the patient's abdomen. All right, and then now I will go and listen for an aortic bruit. There is no bruit noted. All right, now I'll begin feeling for pulses in the lower extremities. I would begin with the femoral pulse, but to preserve patient privacy, I will not be doing that. So if I was looking for a femoral pulse, I would look right here. It's right here. Next, I will go for the posterior tibial pulse, right here in the ankle. It is palpable, +3, regular, and it is equal bilaterally. Next, for the dorsalis pedis pulse. It is palpable, +3, regular, and it is equal bilaterally. Next, I will be checking for capillary refill. It is less than 3 seconds and it is equal bilaterally. Next, I'll check range of motion of the lower extremities. So go ahead and lift your leg for me and then bend at the knee, and bend the ankle, and roll it, wiggle your toes. All right, other leg, please. Great, put that down. Go ahead and push against my hands and this way. All right, you can go ahead and sit up. The range of motion and strength is appropriate for age in the lower extremities. And moving on for the upper extremities, go ahead and put your arms out, bend at the elbow, bend your wrist, look at your fingers, go ahead and grab my hands. The range of motion and strength of the upper extremities is normal for age. Going on to the pulses of the upper extremities, I'm going to feel for the brachial pulse. here. It is palpable, +3, and it is regular and equal bilaterally. And then the radial pulse. It is palpable, +3, regular, and equal bilaterally. And finally, for the capillary refill, it is less than 2 seconds, and it is equal bilaterally. Going ahead onto the patellar reflex. Go ahead and scooch up and dangle your feet a little bit. Let me see. All right. The patellar reflex is 3. And to test for clonus, I would dorsiflex and plantar flex the foot several times and then let it go. And if it continues to push and move, then that is a positive response. And a negative test would be that the foot falls down. Next, I will test for sensation. So go ahead and close your eyes, please. And tell me where I'm touching you.
Right shoulder, left knee, right knee.
All right. The sensation is intact. Okay, thank you, Mrs. Poe. Ms. Poe, for our exam today. Your collate is within reach. Your 2 of your bed rails are up, and your bed is lowered and locked. I have maintained HIPAA, and I'm going to go outside and document our findings from this exam today. Please let me know if you need anything.
Thank you.